Well, good morning, all. I'm glad you could join us today. Thanks for having your names on screen and as many of you as possible on camera. That's kind of nice for the speakers. And so we're going to go ahead and get started. We asked, looking at the ARPA funds and the ARPA program, there are a couple of more obvious places for nonprofits to engage. And one of those is in the economic stabilization, and another is in Department of Public Health and Human Services. So we asked Director Foster, along with the Director of Commerce, Scott Osterman, and Director of DPHHS, Adam Meier, to join us today. And we're going to start with Director Foster just giving an overview of ARPA, and recall that ARPA is the American Rescue Plan Act, and it has several elements, but we might think of it as kind of the overarching goals of the plan and then the funding that goes along with it. It's not just funding. There are these goals. So that's really what we want to talk about. And so we'll moderate the questions through chat. We'll have one of our staff, Shelby Regala or Tylin is on, and Leandra will be working on monitoring chat. So we will moderate that and not, we won't have, people direct questions throughout, but more use the chat if you would, just to keep the distractions down for the speakers. So Director Foster, really appreciate your being here. And then do we have Director Osterman here? If you are,
yes, I'm on.
Wonderful.
Yes, I'm on.
I see you now. Great, thank you. Okay, Director Foster, we'll start with you. And maybe you could just give us kind of the big picture of ARPA.
All right, Liz, thank you. Good morning, everyone. The actual ARPA bill became law in March, and during that time, the legislature was still in session. And so the legislature and the governor's office went to work in putting together actually a couple of bills to address the ARPA, what it meant and how we could administer it and implement it in Montana in such a way that it would reflect what we want as much as we can. Because with that, the ARPA bill, some of it is just a direct payment to different entities such as tribal governments. We don't even touch that money, that just goes. So when you think of the whole ARPA world for Montana, it's about $3 billion, but some of that goes, like I said, directly to some different groups and we have no role in that. Also, some of it is pass-through. So there's money, for instance, for cities and towns that went to the state budget office, but all a city or town had to do is fill out a piece of paper applying for the money, and it was already figured out exactly how much money they would get, and they got the money. So it wasn't like there was a big decision-making process involved. So what we're focused on is the money that we can decide who gets it and where it goes, keeping in mind the goals that Governor Gianforte has made very clear about trying to get the biggest bang for the buck, that there would be long-term benefits for this one-time only money. And in doing that, we wanted to make sure that it wasn't just like a giveaway or to bail somebody out or something like that. It really had to be meaningful. So with House Bill 632, we established 4 different, what we call advisory commissions. And those commissions are made up of a combination of legislators and executive branch people. And the role is that a department will make a recommendation to the advisory commission, and then the advisory commission makes a recommendation to the governor, and the governor has ultimate authority about whether or not to approve money going to different areas. And so with these four different advisory commissions, one deals with infrastructure, which is water and sewer primarily. And then also there are irrigation projects that are eligible to apply for that as well. And then another one is communications, which is basically broadband. We thought it might be a little broader than that, but with ARPA, they've come out, there's the bill itself, then the US Treasury Department issued their rules, as you would expect, following that. And then they've also been trickling out these frequently asked questions, FAQs, almost on a weekly basis to further define what they mean. And that's sometimes caused us to be a little frustrated with trying to be efficient, but at the same time having to go different directions at different times. So the communications part is really boiling down to broadband. And so there was, when I said there were two bills that the legislature developed, the other one was Senate Bill 297 that established some of the technical aspects of what the broadband would look like in Montana. And Director Osterman was highly involved in the development of Senate Bill 297. So, so that's two of them. The third one is the Health Advisory Commission, and that's mostly DPHHS programs. It's kind of interesting because with some of them, there's like 27 different line items of programs and special projects that DPHHS is doing, and Director Meier can address those. This has been an extremely active advisory commission in addressing those proposals where the feds will send money here and say, they'll give some parameters about this is what this money basically should be used for. So I'm sure that Director Meier will talk about that. Then the fourth one is economic transformation, stabilization, and workforce development. And that's the one where it's a little more broad about what we can use and what we can fund there. And the key term there is eligible use. And that's where we've kind of been moved from one understanding to another when it comes to Treasury guidance. So that's in a nutshell what we're doing, and these advisory commissions, except for the communications one, have been very active. The Communications Advisory Commission will become much more active here soon. But we had to get some things in place first, and so it's moving along, just not nearly as quickly as the others. And and one other thing for that, the Advisory Commission dealing with economic transformation, stabilization, workforce development, the Advisory Commission adopted 4 categories of funding allocation. So business innovation and workforce development and housing and agriculture, value-added infrastructure. So those are the 4 categories that they're mostly going to be working on. The last time they met, which was last week, they recommended to the governor to adopt $15 million for affordable housing. It's gap financing. And again, Director Osterman can give you details on that, but that successfully made it to the governor's desk, and I'm pretty sure the governor has signed that. So that's a done deal. And
Director Foster,
yeah, go ahead.
A question for you. The Department of Treasury FAQs, does the Montana arpa.mt.gov, does that website kind of mimic those FAQs, or do people need to be tuned to both the Montana and the federal websites?
Well, I believe that there's a link
Okay,
on our website, arpa.mt.gov, that can take you right to those
okay,
FAQs. I believe that is the case. And I'm glad you mentioned the website, because I mean, it's like a lot of things. We started from nothing, a couple of months ago.
right.
And we've done a tremendous amount of work. And the website now, the last number I saw was 23,000 contacts that we've
Wow.
had. So it's very active. We have a call center that you can also dial in. You can dial the number and let me give you what that is. It's 844-406-2772. And the 2772 is on your, the letters on your phone. That's ARPA.
Oh, okay.
We're very clever. Yes.
That's great. That's great.
And you'll actually be linked up with someone who can answer questions with that call center. We didn't want it to be just take a message and see you later. It actually means something. But
Okay, that's great. Oh, good. Somebody else typed it in. Thanks, Leandra. You on the website, well, first of all, compliments on the website. I spent some time last week looking kind of through the Northwest at the various websites, and a lot of the states just don't have a cohesive website for their ARPA program. And Alaska has a good site, and Montana has a good site. So congratulations. I know that's been a high priority for you, and
yes,
we
thank you.
appreciate it. Yes. On the commerce one, and maybe Director Osterman will speak to this, but it does say, information and grants, but it doesn't appear to have grants yet. So can you take a minute before we talk with the other two directors to speak to the difference kind of framework wise between the CRF funds that came last year that were really kind of rapid, save us kind of money, versus this, which is more forward moving, targeted to recovery, I would say, than survival. Maybe that's a crass way to put it, but can you speak to that a little bit?
Well, you're absolutely right, Liz, that what was done in the previous year were like quick money, get it quickly into the economy and address some obvious needs that needed to be done and had to be spent quickly. It couldn't be, divvied out later, as opposed to ARPA money, which, and it varies sometimes, but typically it's that you have to have the money obligated by December 31st, 2022, and you have to have the money spent by December 31st, 2024. And that's not 100% true on every one of these programs, but that's just kind of the general rule. So there's a little more time when we can do it. And it, when you mentioned the commerce grants, if you're talking about the business innovation aspect of the economic transformation, stabilization, and workforce development advisory commission, the reason is that we haven't quite figured out yet. We're working very, very hard in getting that nailed down as to exactly what that's going to look like. And so you aren't seeing anything there yet. At this point, people can submit comments and proposals in the website, and we welcome that. We encourage people. We have the approach of saying that proposals that come from outside are a good thing, and they deserve very strong review and taken very seriously. It's first is it eligible? And then if it's eligible, where would it fit in our silos? And so the reviewers will look at a proposal, for instance, and they'll say, well, this part kind of fits in health and this one fits in econ, those kinds of things. But the approach is to try to give people the best opportunity possible, with no guarantees, of course, but
Right.
for consideration of being a winner.
And then do you have anything that prioritizes ensuring that more rural or less sophisticated local governments and communities and nonprofits would have access? I mean, sometimes people just don't have as much, they don't have as many resources available to help them put things together.
In the Infrastructure Advisory Commission, that's the water and sewer projects, that, we're seeing a lot of rural proposals, and they've been scored because, we well understand. That's one of the points that we talked about, is that if you're the city of Billings, you have a lot more access to engineers and architects and whatever you need in the way of expertise than the town of Saco. And
Right.
so we have technical assistance from the Department of Commerce to help with those proposals. And that's just an example of where we recognize that there is that differential, and we try to create as equal of an opportunity as possible.
And then before we move on, if folks submit a proposal and it's not, is there someone that would reach back out to them and say, here's what we really need? Or if people had questions about how to submit a proposal, is there anyone beyond the call center itself that could say, here's really who you should talk to?
Yes, that's something we talk about a lot, that we make sure that the expertise within the departments are utilized to help people. And with the infrastructure, for instance, it's very common for those applicants to work with both the Department of Commerce and the Department of Natural Resources and Conservation. And it's possible that DEQ, Department of Environmental Quality, could be involved too. We're trying to have, as much as possible, the help that people might need to make sure that their proposal is in good shape.
Wonderful. Thank you.
Mike, if I could add to that on the infrastructure grants, what we've done is we've actually contracted with outside engineering firms, as well as having our own internal engineering expertise to be able to help those smaller communities that do not have, either can't access engineering firms because of how they're constrained today as well. So, we're trying to reach out and help those individual communities that, with the expertise being sort of pre-contracted, if you will.
Thank you, Director Osterman. So thank you, Director Foster. And I think we may have some questions, but and I think we'll come back to the question on water sewer projects. Director Meier from Department of Public Health and Human Services, thanks so much for joining us today.
No problem.
Yeah.
So I'll talk a little bit about the Health Advisory Commission specifically. And as Mike Foster mentioned, the commissions were formed in House Bill 632. Our particular commission was predominantly, it was the legislators from Section B were put on, and then the three governors appointees are myself, Anita Milanovic, who's the governor's general counsel, and then Charlie Brereton, who's the governor's health policy advisor. And so that's what makes up, those are the members of the actual commission. And then we at the commission are charged with making recommendations to the governor for approval on how to use those funds. And so the way the process has worked is we've had, I think maybe four meetings so far. We'll put the agenda up on the website, and then we'll go through and we make proposals to the commission, and I usually lead those, talk through the proposals for each funding source. One thing that's unique about our advisory commission is that the funding sources, there are a lot of them, but they're typically very prescribed. oftentimes very narrow in their use. And so we did set up a website early on. If you go to arpa.mt.gov/health, that actually will take you to those funding sources specifically within the Health Advisory Commission purview. And then with any of those that we felt that there was some discretion in how we could use those, we actually have a comment form tied to that particular funding source where people could then submit ideas or proposals for the use of that funding. And then if we got those in advance of a meeting of where we talked about that funding source for recommendation approval, oftentimes we were working with stakeholders, incorporating those ideas into our proposal. And then some of those, maybe things, right? If it's like the SAMHSA block grant, if there's an idea that comes forward after that funding has been approved, but it's within the purview of what it's been approved for, that may be something we could consider for a grant, and we could reach out and say, here's the process for applying this type of thing. So maybe I'll just walk through.
Would you repeat that website again? It's arpa.mt.gov/ okay, health. Okay,
Yes.
great. Thanks.
And so just as some examples of what has gone through it, and we have a meeting this month. We got probably about five more proposals to put forward this month. I think August 25th, I believe. But we've actually worked through most of our funding sources already for approval by the governor. So we've been active. I think we've had over 20 or so, over $100 million, maybe over $200 million. I don't know the exact number, but quite a few different proposals that we put through. One, we had, and I'm just kind of using the amounts that were in 632, supplemental nutrition assistance program. There was $11 million. Most of that was for increased benefits for SNAP eligible individuals. But then we also had some allocated for administration and enhancing the employment and training program. There was $200,000 for the commodity supplemental food program, $900,000 for family violence prevention, $1.1 million for child abuse prevention, $22.5 million for vaccine distribution and supply. And I'll mention on this one, and then the next one, which is testing and contact tracing, which is $143 million. The public health, the way that funding has been rolling out is that it's been coming down in like more narrow grants. So we don't just get, a $22 million grant or $143 million grant for that broad purpose. They're usually utilizing existing CDC cooperative research agreements or grant programs, and then they're kind of plussing them up and then putting parameters around them. So as an example, there was funding put into an STD grant that we typically get, a couple $100,000 for each year. They plussed it up to increase access to intervention specialists for in disease prevention, disease intervention specialists. For the vaccine distribution, another one was the back to school grant, right? That kind of draws down from that higher pot of money. The CDC sends it to us with the parameters, says here we can use it for. And so what we find ourselves doing is, as those come in, we'll take those to the commission and say another batch of funding came for this higher allocation that was in 632, and then we'll kind of talk through the parameters and how we can use that, approve it, make a recommendation. Another big area was the child care block grants, and I do see some, probably there's a lot of your members that will be interested or have some overlap there, but there was two grants. One was they totaled about $112 million. One was the child care stabilization grant, which we had approved back in, I think, July, maybe June or July. And that was really focused on providers who were existing at the time the pandemic started. So really trying to help stabilize that existing childcare provider network. There's also the expanded block grant, which is a little bit more flexible and broader, and we'll talk through that in this next meeting next Wednesday. And that is, I want to say that's around 40 or 43 million, I think. And so that's in addition to basically our standard block grant that we would get each year for childcare. It does allow for some extended uses. So we're looking at, what are some things that we can do there? I have been working with a number of stakeholders, both internal to like DLI, for example, to government, but then also external chambers of commerce and other stakeholders in the community. I've done surveys, so we've gotten a lot of really good input. And then of course, great input on through our public comments as well.
Wonderful.
State vets homes. There's been a public health workforce grant. There's been a couple increases in the two big block grants we have with SAMHSA, the substance use block grant and mental health block grant. Been a pretty significant increase for the LIHEAP program. And then also a similar new program for water assistance for clean drinking water. Increased the Older Americans Act funding that really flows out to the AAAs. Emergency food and shelter program, pandemic emergency assistance, I think will be on our agenda next week. There was an increased allocation for WIC for the summer. IDEA, infants and toddlers, there was some additional funding. And then they're through a different pot. So those were the ones that kind of came through ARPA specifically. There's also the 602 funding, which I'm sure doesn't mean anything when we just started out there, but what that was, it was a different part of the bill in ARPA that was more flexible. And it just kind of had to tie back to a COVID purpose. And so the legislature actually allocated $15 million for nursing home and hospital swing bed payments. And then also, I think 2.75 maybe for a provider rate study. 2.75 million, I think is what it was. So we'll be doing a provider rate study as well. We've not had one in a long time.
Okay, so that provider rate is behavioral health.
That'll be everything. So it's written that so that we have a contract that's in process, an RFP. And so when that's awarded, it'll be a task order contract that we can use over the next several years. And we'll use the ARPA funding as far as it takes us. Then we can also use, Medicaid or other types of funding. But there has to be a COVID tie-in. So the funding for COVID, right, we'll look at, how COVID impacted provider rates and, what do we need to do to make adjustments in the future to account for kind of the cost drivers and changes in market and workforce costs, et cetera, that kind of COVID had impacted. So those are some things that I think that it will look at, as well as how do we compare to some of our surrounding states in terms of rates. But I do think, some of those behavioral health, for example, will be part of that, but it can be, and it's written in a way, it's not just Medicaid, it could be, right, it could be child welfare rates, for example. So.
Okay. And the next commission meeting, is it next week?
Next Wednesday, I think I don't know exact time, 8:39 usually is when they start.
Okay. And there's a question about listening in on that. Yes, those are public and you can go to leg.mt.gov, just like a legislative session, and tune into live stream. Those sessions are live streamed. So, and you can also, I'm not sure about registering on Zoom ahead of time and making comment via Zoom, but I think you can. When I've been at those, there have been participants via Zoom, whom I'm assuming registered ahead of time. But we'll put some information out about those commission meetings and participation and registration for those. And then Director Meier, before we move on, are you and Commerce both working on workforce development?
So we're not officially part of the, of that commission. We're not part of that, but we have been working closely with DLI and Commerce on some ideas, especially as they interact with our department. So for example, we have the SNAP Employment and Training Program, and we want to make sure that, we're aligning our visions with Department of Labor and Commerce as it relates to workforce training and those sorts of things. So we've been involved in some of those conversations about, how we can work together on that.
And then with the childcare, has the state remained more flexible this year? I mean, last year there was quite a bit of flexibility about childcare funding, that it didn't necessarily need to be licensed, registered, that kind of thing. And in order to receive CRF funds. And I'm wondering where are you now with childcare funding?
So I think because, as you noted at the front end of this, we're more in recovery mode. The limitations on the federal funding have been a little bit more, strict in terms of what we are allowed to use them for. So I think that, they're looking for us to try to incentivize getting back to more normal licensing standards and those sorts of things as well.
Okay,
But if you have specific questions and want to submit those, I can have our child care division address that.
great. Okay, thank you. Thanks, Director Meier. And Director Osterman, thank you for joining us from Big Sky, from Department of Commerce. And maybe we'll start with a question, which is how to apply for ARPA training funding through Department of Commerce. Nice to meet you.
Hi, nice to meet you too. As far as applications are concerned right now, we are our next econ and business innovation session is September 8th. And right now we're working diligently to work with our community colleges. We're working with the Department of Labor pretty consistently on this, working with community colleges, universities, and other entities. One of which we've become aware of a good many of nonprofits in Montana that are providing workforce training of some type. I noticed there was one in Valley County. There's others that are scattered throughout the state that we actually, some of us didn't know they really existed. And so we would like to have them included in some of our thoughts and our programming to be able to say, hey, where should some of this money go? Because it doesn't necessarily have to go to all of the more public training institutions. I think it can go to some of those other entities that identify with, we're basically looking at the top 20 different needs for workforce. You get a little bit further down the list, and the number of individuals needed to fill the requirement gets a little bit thinner, and that's something that can be handled more on the business and individual type of basis in terms of where to get them trained and how to do them. But in the greater community, we're looking at trying to define those and set some of those up so that as we put these programs out, starting and announce some of them in the September 8th meeting, you'll have an ability to perhaps apply for some of those grants. We're not quite sure. I mean, this has been a very quickly moving target, and we've had to assess where are the greatest needs, and then where can we have these needs fulfilled and through what institutions and or organizations. So I guess the first thing I would do is encourage any of your members that sort of fit into this category that are doing workforce training to make sure and let us know and make us be aware, because we might not necessarily be aware that they're actually doing this. So that'll help us round out our environment of knowing where can we send some of these training dollars and development to be able to, especially to attack the broader base of need. We know we have need throughout the state for some of these top level professions and or jobs that need to be supported, and not everybody's going to just be able to pick up and go to a location for 6 to 8 weeks or whatever for training. I mean, these are all constrictions that we have to work through. So the greater diversity of environment that we can create and put people into those locations, the more efficient we can be with both with the money as well as the time and the effort that it's going to take to get people into the workforce.
So when you talk about the 20 top areas, is that geographic gaps in workforce, or is it subsector gaps in workforce, or is it workforce needs of the workforce population?
It's sort of we're looking at it first in terms of total need in population. I mean, for example, we're short 1,000 RNs or so in the state. So we know that geographically we have 2 or 3 or 4 different places where we have RN training and the ability to do maybe some accelerated training. Carroll College, for example, has a 15-month program. I mean, some of these things are not going to solve themselves overnight. There are other types of jobs where, a 6 to 8 week certification program or something like that can get somebody into the workforce much more quickly. So we want to look at it on a regionally diversified portfolio to be able to create the greatest impact throughout the state, and certainly look at making sure that we're not leaving Eastern Montana behind, which is, the normal gravity of larger population centers and everything being in the West makes it a lot easier to sort of, put people into those programs. But,
Right.
we've got to take care of the outside regions as well, and the more rural areas.
Well, thank you. And I appreciate that, especially that emphasis on very rural Eastern Montana. Childcare and housing are two issues that impact workforce so much. And how are you intersecting those gaps?
Well, as Director Foster mentioned, we have provided we're going to provide $15 million for gap financing. And that gap financing is, for the most part, oriented towards workforce style housing. That we have projects that, through the pandemic and through the various constraints in supply chain and extension of times and the costs involved with that, need to have some help to be able to get across the finish line, and that are not necessarily, there may be extended under the bank financing. And I can't remember the number on, I think maybe Adam, who's online, can remember. I think it was about 2,500 total dwelling units that will be positively impacting to get them to help finish over the finish line for this. And we've had a lot of those submissions, and I think we're already kind of on our way with that. And so that's one area. I think in terms of the focus that we have. I heard a very good comment from Neil Kashgari yesterday and I think this is incumbent for all of us to really look at ourselves in the mirror, and it's exactly what he said. Neil is the president of the Minneapolis Reserve Bank, and he said, what we see normally across all of his region, which essentially is Minnesota, the Dakotas, Montana, is that they notice quite quickly that it's the local entities that are constraining the not in my backyard growth and the constrain the availability of housing. It's not the actual availability of housing. It's some of the things that we've done to constrain growth, and which has then caused obviously to have a supply and demand effect of the price going up. And so workforce housing, I think we need to, from a governmental standpoint, from the state level, we're going to, we can't take a lot of barriers away, but we can work on certain barriers. I think the local level, the counties and the cities really have to look at it. Growth is going to happen. Let's remove those barriers, and we'll help in any way, shape we can. But as far as the private sector is fully capable of funding and developing the workforce housing we need, I've been engaged with numerous developers that, comments like, I can build 2,000 to 3,000 houses in the next year if you don't make it difficult for me to have to go through a bunch of hoop jumping contests to be able to do that. So I think that's a challenge for all of our communities, quite frankly, and to be able to allow the private sector to build houses that are in the $200,000 range or even less, depending upon where in the region we are, and make that affordable housing reasonable to support our workforce. As far as childcare is concerned, we're not as heavily engaged in the childcare side of the problem. I am and have had some interesting conversations with the co-op organization that runs out of Great Falls about what about companies and/or organizations forming childcare co-ops. We have talked about developmentally in the workforce housing area, making sure that in workforce housing, we actually, they'll have a central area, but maybe we also, work to make sure that we have a pre-designed and a place for workforce or for the workforce childcare to be taking place too, and come up with co-ops to maybe be able to support that. So I think there's a lot of different ideas. I'm not sure how we would fund some of those types of things, or if they would be coming through the workforce development and business innovation side. But I think the innovation is there and the opportunity is there to be able to support that.
Thank
Just
you.
to add to that, we do have a number of the things Scott's talking about that we've gotten, input from the business community. Those are some of the types of things that we'll talk about next Wednesday. As I mentioned, the child care stabilization grant was focused more on really just supporting and standing up existing providers, but we are doing a lot to focus on capacity building and expansion of child care access with the next tranche of funding for the expanded block grant.
Thank you. And then the water, sewer, and the infrastructure. Talking about water, sewer for a moment, you talked about city and county, and I know many of them are focused on that, particularly, well, both city and county. But is any of that funding available? Somebody had asked a question in the chat, if that funding is only available to local governments, or if there will be the opportunity for water, sewer kinds of projects that might not be that massive.
Yeah, I think, go ahead, Director Foster, you can answer some of that.
Well, I think it really depends what you're talking about. There's all sorts of different applications that have come forward. We had over 300 applications. That it's not just water and sewer, it's also irrigation projects, because they're in the mix as well. And is it all municipal? Well, there's some subdivisions that have been included in there. So I think it's a broader range than just like a city drinking water project.
Right. Okay.
I think so. We certainly have seen some of the shovel ready and some of the highest priority and highest need ones are some, especially in more rural areas, are some of those that are moving their way through the system and that we have, that have been scored and that sort of thing. So I think the highest needs probably will be handled first, and most of those might likely be, and this is just my sense, the municipal type projects, especially ones that have some extremely aged infrastructure that needs to be handled. But over time, as Director Foster indicated, I mean, there are a variety of different projects. So we haven't eliminated anything. I guess to answer your question specifically, nothing is off of the table at this particular point. And since we only got half of the money issued to us from ARPA. It's coming in 2 tranches, one this year and another half next year. So there will be additional funds that come along to be supported for that in the next rounds that go forward.
Is there specific funding for community planning, for bringing partners together to ask what is best for this community? How best can we use what's available to sustain our community for the future?
So we have go ahead.
Well, that can be part of the application. Yes.
Okay.
Right.
But I should say too that House Bill 632 required a rating system, a scoring of these applications, and Department of Natural Resources and Conservation has been in charge of that, with great assistance from the Department of Commerce on technical assistance for the applicants, and the Department of Environmental Quality has pitched in where they have an interest in some of the things that are going on in various communities and projects. And so the ARPA bill requires that the safe drinking and drinking water and wastewater rules be applied in scoring and determining eligibility. And so, I mean, for instance, there was a proposal for a swimming pool. Well, as much as we'd all like to have swimming pools, it was not an eligible use, so it could not be considered.
Okay. And then, and we have a couple minutes, folks, for questions if you have some. Director Foster, there was a question about, the 4 commissions versus the 6 primary interest areas on the website. Can you speak to that just a little bit?
Yeah, the other 2 are housing and rental assistance and K through 12. The housing and rental assistance, which Director Osterman could talk for 2 hours about.
Right.
It's a very high interest area, and it includes both ARPA money and federal money from previous programs. And so we just thought that it would be great for people who want to inquire about it, that they could just have an easy link by clicking on that one. So no, the Economic and Workforce Advisory Commission is addressing these issues, but this isn't a specific advisory commission. It's just a very popular or high interest program. And the same thing is basically true at K through 12. K through 12 through OPI, the Office of Public Instruction, they got the federal money directly. So, and they can use it for certain things that are COVID related, all the things that schools are doing. And so we don't have an advisory commission that's dealing with education. It's more of the feds gave them the money and said, here, go forth and do good things. But again, we figure that people are highly interested in what's happening in the schools. So we wanted to provide that link. Great,
thank you. One comment, and then we'll be wrapping up. I think for folks on the line, just to note that and I think we can chat this link in, the Treasury has a link that shows what funding went directly to counties, and it lists it by county in Montana. And so you can look at the Treasury, the US Treasury website, and see what went into counties directly. There's also funding that went into municipalities. Most Montana municipalities are not large enough to have an amount shown. So there was another formula that was applied to kind of the non-entitlement municipalities that are smaller, if I have that language correct. So I think for nonprofits, just to be really tuned into working with city and county government on, what are their plans for that funding, and what is the role of nonprofits in being a partner in carrying out those plans and the vision for the community. And then I think a last question perhaps for the 3 of you would be, how can nonprofits best be a resource to you and help you carry out the vision of the governor's office and the legislature and other stakeholders in Montana's recovery? Director Foster?
Not-for-profits obviously play a huge role in Montana, not just from an economic standpoint, which is obvious, but also in providing services and assistance in various ways that is really essential for the success of our state and the people. And so I would just recommend to keep a look on the ARPA website and be talking to the departments that you're used to working with, and if you familiarize yourself with what these advisory commissions are trying to do, then if you can find a way that you can submit something, and many of you have, it's not like that we haven't heard from any not-for-profits. We certainly have. And so it's just a matter of if there's a good fit and if it's an eligible use.
Great, thank you, Director Foster. Director Osterman, Director Meier?
Yeah, I just might say that, we really need to rely on anyone and everyone out there and to give us feedback. I think it's important that we understand what the issues are in various communities. There is, to answer a little piece of your question from before, there's workforce plan, or there's planning grant availability standard from what we have in the Department of Commerce, but there's also some additional monies outside of ARPA. I mean, they're inside ARPA, but they're outside 632 monies that are now starting to show up, both tourism planning and a whole bunch of other types of things. And so we're working our way through that. And so I would say that make sure and go look at the ARPA, the government, U.S. government ARPA website to look at what some of those others are. I mean, they've put out $710 million, for example, for oh yeah, and I think Adam just posted it, eda.gov.arpa/ARPA, and they put out all of these additional programs that are out there, which we're actively working with. Some of them are coming directly to the state. Others are competitive grants for us to apply for, and see if you fit in some of that environment as well. But communication is key for us to make sure that we're actively working in the broadest and the most common good to solve problems that are out there. And unfortunately, and I think Mike and Adam can both testify to this, that we haven't been able to get out as much because it seems like there's an ARPA meeting, at least in my case, there's an ARPA meeting almost every week, whether it's broadband or workforce or it's infrastructure, and it's hard to get out and really listen. And so, we need to hopefully have you guys reach out and tell us a little bit more, because we haven't been able to escape Helen as much as we'd like to.
Okay, thank you, Director Osterman. Director Meier?
Yeah, I mean, I think just to echo some of the same sentiments, I think just making sure that you're reaching out. We've tried to make us accessible, online. So make sure that you're looking at our website, looking for posts on agendas, meetings. Reach out. Many of you have established a relationship with our division administrators and others in our department. Make sure you leverage those relationships to, first of all, let us know that you're standing by to help and you have ideas, or to submit ideas. So that we're aware of what's out there. I would agree that we're having trouble getting out because we're either planning for an ARPA meeting or having an ARPA meeting, and so it has been a really big bandwidth issue for us. A ton of work to get ready for those, and I do want to thank many of you guys who have been giving input and have been lending us an ear on our ideas and have submitted ideas. It has been helpful, and we really appreciate that feedback. And just, one thing I'll point out is adding some new capacity and doing some reorganization within our department. In one position, I'm creating a faith and community-based coordinator, faith and community-based organization coordinator, so that we can, right, when I am stuck in Helena and we can't get out, we have somebody that's working with organizations such as yourself to, be able to lend the ear of the department, and get out to your organization's meetings to, give technical assistance and those sorts of things. So trying to even increase our ability to provide that improved customer service with, our stakeholders.
Wonderful. Well, thank you, all of you. And thank you, Deputy Director Schaefer, for joining us as well and chatting the links in. And, I think for for the nonprofit audience, my experience and what I think I hear is that, formal structure of an idea or an application or a proposal is not as much of a priority as thoughtful, innovative ideas, and just getting those ideas to the departments who will then work with them or move them along or put you in touch with the right person. So I think, my message would be to not be intimidated. You have an open door, and that's one of the gifts of Montana is availability of being able to contact people. And so you have that door open, and it sounds like you're being encouraged to give feedback and be a resource and be a partner as we all emerge in fits and starts from a really tough time. So thank you for your service, Director Meier, Director Foster, Director Osterman, and thank you all for joining us today and for all the good work you're doing in the corners of Montana. Take care.
Thank you, Liz.
Thank you. Bye.
Thank you.